Ketamine for depression. How much and how often? This is a question I frequently am asked in the office. I'm Dr. Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And ketamine has been found to be highly effective for the treatment of mood disorders and depression for the past 20 years, starting with initial studies in the year 2000 with Dr. Berman and Dr. Crystal, which demonstrated a 70% effect in terms of the treatment of depression after a single ketamine infusion. So when patients come into us and are evaluated for treatment-resistant depression or other mood disorders, the question is always asked, how many infusions will I need, and how often will I need follow-up infusions? So we know from several meta-analyses of randomized, double-blind, placebo-controlled studies that the efficacy of ketamine as a rapid treatment for major depressive disorder is effectively been consistent in terms of its ability to demonstrate response and remission rates in individuals who have suffered from severe mental health disorders, especially treatment-resistant depression, and have failed multiple therapies. In one study by Han and others in 2016, they took 9 studies that included 368 patients as an example, and these were all randomized controlled studies, and then evaluated the efficacy of ketamine. And what they found was that at 24 hours and 72 hours and day 7, that ketamine therapy resulted in significantly better antidepressant responses than placebo. And this type of study and meta-analysis has been demonstrated in multiple settings. A systematic review and meta-analysis of IV ketamine infusions for treatment-resistant depression, taking studies from 2009 all the way through 2019, done with a study from Mercanti and others, used approximately 28 studies and demonstrated that there was a strong ketamine effect that showed within 4 hours after a single infusion and peaked at 24 hours, demonstrating an antidepressant effect, and that even at 7 days, there was still some antidepressant effect, although somewhat diminished. They also demonstrated that multiple infusions resulted in an enhanced and prolonged ketamine effect. And this is what we find in the clinic as well, is that a series of infusions and follow-up infusions can maintain the efficacy and antidepressant effect of ketamine and can also make the underlying medications work better for these individuals. Now, we generally will measure improvement based on traditional scoring systems that are medically validated, such as the PHQ-9 and the MADRS scores and the Beck Depression Inventory scores as examples. So there are actually metrics by which we can demonstrate improvement or remission with ketamine therapies. And so in this particular systematic review and meta-analysis, it basically provided further support for ketamine as a promising and innovative treatment in the rapid management of depressive symptoms and treatment-resistant depression. So again, ketamine works rapidly, and in this case, it was demonstrated within 4 hours of initial therapy in some of the studies that were evaluated. And the effects after a single infusion may last even a week, but multiple infusions really enhance the duration of effects and also improve the outcomes. And that's what we find as well in our clinic in Nova Health Recovery. So what dose of ketamine works best for depression? Now, Fava and his group basically used a double-blind, placebo-controlled, dose-ranging trial of IV ketamine as adjunctive therapy in treatment-resistant depression. And this was done in 2020. And basically, they took 99 subjects and tried a series of different escalating doses to see the efficacy. And the doses ranged from 0.1 milligram per kilogram to 0.2 milligram per kilogram to a single dose of 0.5 milligrams per kilogram all the way to 1 milligram per kilogram. And this was compared also with a single dose of midazolam or Versed, which is a benzodiazepine. And effectively, what they found was that when they controlled for various factors, that the standard dose, 0.5 milligrams per kilogram, all the way up to the 1 milligram per kilogram single intravenous dose, were superior to active placebo, and also that the lowest dose was less effective than the dose ranging between zero point 0.5 to 1 milligram per kilogram. Generally, at Nova Health Recovery, we will initiate our treatments at the lower dose, the 0.5 milligram per kilogram, based on ideal body weight, and infuse that over 40 minutes. And we escalate the doses upwards towards the 1 milligram per kilogram IV dose over 40 minutes over the period of several infusions. So the best doses, it seems, are the 0.5 milligram per kilogram up to 1 milligram per kilogram of ketamine over 40 minutes. Now, how often does an individual need infusions of ketamine initially? Well, we recommend that a person get 2 to 3 infusions per week for a total of 6. Most patients do best with 3 infusions per week for a series of 6 infusions over 2 weeks. Generally, it's best not to let more than a few days pass between the initial infusions during that series. Now, a lot of individuals will notice their first results or improvement to be approximately around the 4th infusion. Some people, though, will notice that they feel a little bit better after the first infusion, or some sense of lightening or improvement of specific symptoms, especially when it comes to depression. And for others, the anxiety symptoms may take a little bit longer to improve. Now, the reason that we will use 3 infusions per week is based on a number of randomized controlled studies. And one in particular with Singh and his group in 2016 did compare twice or thrice weekly infusions of ketamine at 0.5 milligrams per kilogram. And effectively what they found was that the 2 or 3 infusions per week worked well and approximately the same. Basically, the 2 times per week or the 3 times per week were able to maintain antidepressant efficacy over a 15-day period of time, which they were monitored. At Nova Health Ketamine Infusion Center, we generally will recommend the thrice weekly administration of ketamine just clinically because we found that most patients find that they improve more rapidly using the 3 times per week. But the studies do demonstrate that twice weekly can be effective as well. Now, once an individual is able to improve either with remission, with effectively complete resolution of depression symptoms, or at least a response where they get at least a 50% improvement of their depression symptoms, we'll have to consider what would be the next steps. And so strategies to prolong ketamine's efficacy in adults has been studied, and it has not been clear as far as whether there are any other treatments available to prolong the efficacy of ketamine treatment after you have finished your initial series of 6, short of one thing, and that is continued IV ketamine infusions. And a study with Dr. McIntyre's group in 2021 reviewed approximately 454 articles, of which 22 articles were included. And they looked at all sorts of pharmacological interventions and psychotherapies, electroconvulsive therapies, TMS, and other intravenous monotherapies to basically determine the impact of prolongation of the antidepressant effects following acute ketamine treatment. And they didn't find any particular modality to be effective other than repeat dosing of IV ketamine. And basically, this was the only way to prolong the acute efficacy of IV ketamine in treatment-resistant depression. So what we find at Nova Health is that individuals generally need infusions every 3 to 4 weeks whenever they are feeling poorly. So after the initial 6 series, most will come back around week number 3 or 4 for a single infusion. But we also use microdosing of ketamine as well, whether it's by oral or intranasal, to help maintain that efficacy in between. So ketamine, although initially developed and approved by the FDA as an anesthetic in 1970, has definitely found its way as a rapid-acting antidepressant treatment. It has been very robust in its effect, and again, approximately about 70% of all patients who have failed multiple other medications have been able to have significant improvement, if not remission, with ketamine infusions. These results can be maintained with periodic infusions and also with home-based therapies as well, such as oral troches, ready-to-dissolve tablets, and intranasal racemic ketamine as well. And these would be done on a microdosing fashion.